It's a respiratory virus, so it goes in through the eyes, the nose, the mouth. It goes into our airways. If we aspirate
So if we get it on our hands, and we don't touch our face,
you won't get it. If you get it on your hands, you get it on something, and you wash it, you'll get rid of it, then you'll be fine. Just as long as you don't touch your mouth, touch your nose, touch your eyes.
This is a coronavirus update. I'm Mark Hayes here with Dr. Gary Visser and Dr. Adam Langley. A lot of you know I have deep roots with Medical City and the Lake Nona Institute. We work with Advent Health and Orlando Health and Nemours. Amazing specialists, but these are my quarterbacks. These are my doctors, my family doctors, and have been for a number of years. And you guys are on the front lines of what's going on. And so what we're gonna get into their practice and them later, but I want to get right into what's important. The coronavirus, we're gonna talk about what it is, what you should look for, and what you should do if you have symptoms. Is that fair enough?
Sounds good. Thanks for having us on here, Mark. Appreciate it.
Yeah. So what is it?
So the coronavirus is it's a totally known family of viruses to this world, but this specific type of coronavirus is new to humanity. So
new to humanity.
Correct.
Explain that.
So to humankind, we don't know. We've not been exposed to this virus until just in the past few to several months. And it turns out that it started in China, and it was located to have originated from a fish or animal trading market out of a particular area in China. And we think it came from a variety of animals, maybe a bat, maybe a pangolin.
Yeah, pangolin, yep.
And that is...
Wait, what?
A snake.
Pangolin is kind of like a
armadillo. Anteater with scales on it.
But you guys had mentioned that when they found this, they kind of already tested it or figured out the DNA of it, or
they did. Within a few weeks of discovering this was something new, they had gene sequenced it. They had done testing, and they had developed detection tests to test for antibodies as well.
Okay.
And they've already started working on a vaccine.
So are you guys confident we're going to find something pretty soon?
We'll have a vaccine, but it's not going to be this season. It's going to be probably about 12 months out.
Oh, really?
Yeah. So we will have a vaccine. We will have antivirals, but the problem is the testing and everything to get them up and going is probably going to be about 12 to 15 months or so.
Vaccine development is very stringent, and it's pretty time consuming, but it's very rigorous on making sure that everything is safe.
Right. You had mentioned in here it's close to SARS and other strands?
Right. So the coronavirus family is responsible for SARS and MERS, and so those came out in early 2000s and 2012, and so those were pretty quickly isolated just by not moving, and so that was probably the most effective treatment for both of those.
Yeah. So they called this the COVID-19 because it started at the end of 19. It's the coronavirus.
Right.
Coronavirus has a halo around it, so that's why they named it that.
Interesting.
Plus, they added the SARS part to it. Now it's SARS-CoV-2 because we had the one in the early 2000s.
Right.
This one, so SARS is technically a severe acute respiratory syndrome. So it's attacking the lungs. That's why it's called SARS. So
see, I read here you said the virus appears to be containable as long as movement is stopped long enough. So walk us through how the virus, when you get it, like what happens to your body and how you get rid of it.
So at first, when you get it, you don't know you have it. 80% of people
most
are
people
completely
don't know they have
without
80% don't know they have it.
So most people are going to, I would say most of us are going to get this virus. Most of us are not going to know we had the virus. You know, there's going to be a percentage that are going to be symptomatic, and then there's going to be ones that are severely symptomatic that are going to have to go to the hospital.
How do you think we're going to get it? Let's talk about how it spreads.
Oh, good question. Yeah, so it's a respiratory virus. So it goes in through the eyes, the nose, the mouth. It goes into our airways. If we aspirate
So if we get it on our hands, and we don't touch our face,
you won't get it. If you get it on your hands, you get it on something, and you wash it, you'll get rid of it, then you'll be fine. Just as long as you don't touch your mouth, touch your nose, touch your eyes. It can't get into our system unless it's through a mucous membrane.
But it's airborne, though.
It's airborne, it's droplet-borne, so every droplet of spit or anything we have, nose, mucus, breathing, that's
you were
gonna
telling me off
transmit the virus.
camera what a cough looks like if you could see it. Tell our viewers that.
So if you cough, you're going to cough thousands of this virus out, and it's just going to go into the air. It can live in the air, but in humidity, it's going to bring it down to the ground. So then you can transport it on your shoes, on the ground. It can live a couple hours outside, and sometimes maybe a couple days inside, depending on what it's on. So if it's a smooth maybe metallic glass surface, it can live for a while. You know, if it's closed, if it's the ground, if it's outside, it's going to get killed by UV rays after a couple hours, so it's not going to last as long. But it's a respiratory bug or virus, so it's going to be spread through droplets, through rubbing your nose, through touching something, and then somebody else touching it and touching their nose. So that's why we have these isolation precautions, is to try to prevent us from giving it to other people or other people giving it to, especially the elderly.
And this is why they say social distancing, 6 feet. Because if somebody coughs, the droplets go about that far out and then settle to the ground.
Or sneezing.
Sneezing,
too,
coughing, breathing.
So let's start at the top. We're going to talk about the symptoms and when you should go get tested. So let's start there. Let's just top to bottom.
All right, good question. So basic symptoms from what they've done in China, they're testing everybody for fever there, because 98% of the people that get the virus that are symptomatic have a fever. So that's.
But you can be asymptomatic.
You can be asymptomatic, which means you're not coughing, no fever, no shortness of breath, and you can still have the virus. Your body's just fighting it off. You just don't have any symptoms. And so fever is our body's defense to fight off the virus. So if it becomes aggressive enough, we'll get a fever.
So if it's attacking you,
okay. So a fever is a way of killing the virus. It's heating up the body to kill the virus.
Thing.
That's why we get a fever. If it gets to a certain point, then it becomes a bad thing. Now it's killing organs, so you got to keep the temperature slightly under control.
Right.
So anything over 100.4 is technically a fever. Yes. So 100.4
is there a better way to take your temperature under the tongue?
Under the tongue's a good one. They have a forehead swab, a temporal scanner. Any of those work.
There's some in-ear
ones. Yep. So any of those are fine if you
see some people using the infrared guns for checking temperatures from a distance. They're not super accurate.
Has to touch your skin.
Yeah, I would say it probably needs to be, they scan it across your forehead.
So if you're out there running to buy toilet paper, maybe you should be going to Walgreens to buy a thermometer. Right?
I would say yes. So
that's
a lot of our patients that we're seeing right now through e-visits, telemedicine, which we'll get into later, we're asking them to check their temperature, because if they have a fever, we're going to treat them a little different than if they don't have a fever. Because that's one of the main symptoms. The other two symptoms, which we call is like triad. So you've got fever, cough, because it goes into the lungs, it's lower respiratory.
Let's go to the cough first.
Yep.
Because I've seen people all around coughing. Can you tell by seeing someone how they cough if it's a good cough or a bad cough? You can't. You cannot. So cough is a cough.
You can't tell if somebody has a flu, a cold, coronavirus,
and just
allergies.
For the last person on the earth who doesn't know how to cough, show our viewers how you're supposed to cough, the polite way to cough. Wait, you got
Turn
that?
away.
Are my kids watching?
We should probably pretend to cough.
Well, we're moving completely to Zoom video. In fact,
Zoom is great.
We're going to talk about telemedicine later, but all of our employees now, we're going to go to working from Zoom, and we're going to bring the Zoom feed in here and then broadcast it out live. So we're making the move too. But let's go back. So the cough. What was the third symptom?
Shortness of breath. Yep. So when it gets into the lungs and it starts creating inflammation, fluid, starts filling up the airways, people can't get oxygen in, so they start getting short of breath, especially if they get up to walk somewhere and they do something, and they used to be able to do that or walk up a flight of stairs. Now they're getting short of breath just doing basic stuff.
Would you test? I mean, how would you test for that? Would you tell you over the phone, walk up down the stairs?
Yeah,
and see
if you walk up a flight of stairs, you technically, when we're doing telemedicine visits or talking to somebody on the phone and they're walking up or they're doing something, they have to take a breath before they speak. So now we could talk and we're fine, but like if you do this, you're gonna be like, okay, so you could tell on the phone if somebody's having breathing problems.
Right.
So that's kind of what we look for.
Right.
Yep.
So off camera, we had talked about kids, and you mentioned here people who have diabetes and heart disease. Walk through who the most vulnerable is,
before we get to that, real quick, you can also get stomach symptoms with this as well. So sorry to not mention that, but you can get abdominal pain, you can get diarrhea, nausea. They have seen people go in the hospital with chest pain, fatigue, so you can get other symptoms. But what they're looking for is that triad, and any type of potential exposure to somebody that might have had it, or recent travel. I mean, not now recent, but travel outside the country. Yep.
So if somebody calls you, you have your checklist, check of what you do.
Yep.
And I'll just say right now, if you don't have a family doctor, I'm going to predict, if it hasn't already happened, that the healthcare systems are going to get overrun, right? We saw this happen in Italy right now.
Yep.
And that's part of the problem. So if you don't have a family plan in place, my wife and I, a couple of days ago, went through all of our specialists, and we thought, we need to be talking to you guys more, which we do, because you're our concierge doctors. But if you don't have a plan in place, listen and write this down, right?
Yep.
What would you be telling our viewers to do with their house and home to protect themselves and their family?
Clean surfaces.
Yep.
If you're in an area that you think is contaminated, like we work in medical offices, so before we enter the house,
What do you clean with? Is soap and water fine, or you have to have the...
Lysol.
Yeah, any type of Lysol, any type of Clorox, any of that stuff would work fine.
So just soap and water isn't good enough?
You'd want to use those types of cleaners for when you're cleaning surfaces, because it can live longer on the surfaces. For yourself, the soap and water is fine. It's mostly because of the mechanical aspect, because you're just getting everything off. You just want it to suds up, and you do it for 20 seconds to get it off your hands. For surfaces, you'd probably want to use something that's got at least 70% alcohol, or a Clorox or a Lysol.
Right.
That's kind of what we use that at the office. And then we have also medical grade ones at the office, which are you can't touch without gloves on as well.
Right.
But at
What
home.
else?
At home, coming home, for us versus other people too. For us, I'm taking my shoes off. I'm putting my scrubs in the washer. I'm showering before I touch my family or my kids.
You are full shower, change your clothes.
Yeah.
Everything. Now, if you're going out to the store, if you're getting groceries, you're getting gas, and then you come back, wash your hands, take your shoes off. Don't bring that stuff into the house. If you didn't come in contact with anybody, you're probably not going to have any droplets on your clothes, so that'll be fine. If you're in your car, you're fine. Now, if you go somewhere and you sit down, there could be potentially something on those seats, so maybe change the clothes. Wash the clothes as well. There have been some reports that if you leave the clothes out, the virus is going to die over a couple of days, so you might not have to wash them, but I'd still recommend washing the clothes. So.
Some reports even saying several hours, so overnight.
Yeah.
Does it live in water? I mean, what about swimming pools and hot tubs and things like that?
It lives in surfaces, so I guess it can get on top of the water. And then I don't think it's going to live in the water. So you can drink water, you can do all that stuff. That's fine. Hot tubs are probably fine. It's mostly going to be the surfaces around it, or maybe on top before it gets disrupted.
How long does it live in the air before it reaches the surface? Is it just seconds, or is it just hang in the air for a while, or?
I'd say seconds.
Yeah, it depends on the humidity too. More humid, it's going to drop faster. Less humid, like up north, it's going to kind of linger around a little bit longer.
Right.
Yep.
And we mentioned
inside versus
shoes.
outside. Yep. Shoes, yeah. Shoes can be a carrier, especially if you cough. They get on your shoes, or somebody coughs, or you walk on something and they're on a surface. Then you bring them into the house. You put your shoes on something else. You just want to be it's okay if they're on your shoes. Just don't touch something your shoes touches and then put that in your mouth. So that's the main thing.
In our neighborhood, there's people all out in the park, in the lakes, everyone's out doing home projects. How do you feel about that? Is riding your bikes in a group okay?
I think being outdoors is good. I think
spread out.
But I'd be very cautious about playgrounds. Kids can spread the virus.
Right.
And so
Our
kids haven't gone to any of the playgrounds.
Right.
But we've been riding bikes. We've been hitting tennis balls. Been kicking soccer balls. We've been walking around the neighborhood. Yep.
You have the symptoms, you think.
Yep.
Walk us through what getting tested is. What happens, how long it takes, where you go.
Good question. Yeah, so there's 4 ways of testing. They're doing a nasal swab, which is the recommended one.
Like the one we do for the flu.
Oh, it's exact same as the flu. Yeah, you just stick the thing
horrible,
in the nose,
but it's not that bad.
all the way back to the ear. No, you gotta go it's like this far.
Longer than the one, because I got tested this year.
Feels like a brain tickle.
Yeah, you gotta get it's.
But is a coronavirus farther than the one you did?
No, it's the same.
Same one.
But
Okay, it's not that bad.
You're supposed to go all the way back there.
Right.
I don't want that going on. But so that's one way. You can do oral swab, where they take a cotton tip swab and they swab the back of your throat.
Okay.
A little bit different than a strep test, but pretty similar. And then those go into a special medium, which is like a liquid that you freeze.
Okay.
And then you send it to LabCorp or Quest. And
right here.
test.
Okay.
They're testing. Health department.
And you guys are testing right now for your patients.
Well, we're recommending right now. It depends on symptoms, really. That's the main thing.
I got you.
So you're not going to test anybody that's asymptomatic. It's just not going to happen right now. We don't have enough tests for that. If you show up at the ER, if you show up at the testing sites, or you call us, we're not going to test people that are asymptomatic. So right now, there's specific criteria for testing. So the World Health Organization comes out with their recommendation, the CDC comes out with their recommendation, and then Florida's health department says, okay, this is what we'd recommend you do. So that's kind of how we follow. Those are the rules that we follow, which we have. But the tests themselves, there's those 2 tests. If you have symptoms and you're coughing and you're productive, like you're coughing up yellow stuff,
right,
and you potentially have been exposed, they can also test the sputum so that you don't have to get swabbed in the back of the nose. And then if you're in the hospital in the ICU or on a vent, or if it's bad, what they'll do is they'll do what's called a bronchoalveolar lavage, where they'll take cells from the lungs and they'll test those, and that's definitive. You definitely can get the test right that way. So, but we don't have any data yet on, what's like the flu. There's a 20% chance when you get tested for the flu that the flu comes back, the test comes back negative, but you still have the flu. We don't have any of that data
False
yet.
negative.
Yeah, we don't.
And you've not had any positive tests? No.
We have not yet.
No.
Okay.
Yeah, we haven't. And most of the people that have mild symptoms, unsure if they've been exposed, they're staying at home. We're just isolating them at home, keeping track of them, which is great, which is awesome for us. We get to call them, check up on them, make sure they're doing okay.
And I wasn't going to brag until the end because I wanted to get into the important stuff first. But I will tell you, having a doctor that you have a relationship with, you can ask these questions to, it's just you sleep better at night. It's it's an amazing thing. I think what you guys are doing is amazing.
Thanks.
Are you optimistic? I mean, do you think this is going to?
Well, it's going to take a while.
Yeah.
I think most of our society is going to do well. Most of us are healthy enough to survive this and develop immunity. This is a totally new virus to our world, so we don't have herd immunity, as they call it, and so our whole population, or all of humanity, hasn't been exposed, so we don't have immunity that helps other people not spread it so much. So right now we're spreading it, and it's spreading fast. Those who are at greatest risk, like was mentioned before, are older patients with additional medical problems, everything from high blood pressure, diabetes, and so on, asthma.
Yeah.
And
we've been getting a lot of questions about people that have autoimmune problems. It's not technically, you're not at high risk if you have like a positive ANA test.
Right.
But if you have lupus or organ issues, then you could be at high risk. So it's not just having a positive autoimmune test doesn't put you at risk. It's the disease that you could potentially have from that. So like lupus would be a high risk patient.
Right.
Anybody with organ issues from autoimmune diseases could be at high risk. We've been getting a lot of questions from that because a lot of people are like, they're younger, but they've got autoimmune issues, so are they high risk? It depends on what they have.
Right.
Really. Just a positive autoimmune test is not high risk.
We're in the, I think we would call it the uptrend in seeing this virus spread right now. And if we are able to stop moving around, then we'll see it plateau and we'll recover.
So you agree with the full lockdown? You agree that we should be quarantined?
Well, I feel
self-isolation.
It's already spread and it's going to spread, and I feel that most Americans are going to get this.
You do?
I feel most of us are going to get this
at some point.
At some point. It's going to continue. It may come down a little bit in the summer months. It's going to probably come back next winter as well. It's going to be kind of like the flu virus. It's going to change.
Seasonal.
But I feel that most of us are going to get this. Now, 80% of us are not even going to know we had it. So that 20% will have symptoms, and then there's going to be a small percentage that unfortunately will have to go to the hospital. But I do believe that the isolation is important now because so the flu is spread out over months. So and there's a lot of people that die from the flu, and there's a lot of people that get sick from that, but it's over 6 months. This is a few weeks. It's going to spread quickly. Your elderly population is going to get sick, and then it's going to be tough on the hospitals to take care of them. That's why we're doing this, is I believe, to spread it out just a little bit so we can give the hospitals times to treat these people so they can get better before the next wave comes in, because Italy was a spike like that straight up, and they couldn't, it was hard to handle.
It overwhelmed their system.
Yeah, if we could kind of maybe level it out a little bit, that'd be way more helpful. So that's why I think.
So if an elderly person gets this and they get diagnosed and they get to a hospital, they can survive.
Sure.
There is a...
Most do.
Most do.
Yeah, if you go into the ICU and they put you on a ventilator, less likely, about 30% chance from what I've been seeing. Survive. Yeah, if you're on a ventilator in the ICU. From what we've been seeing,
that means you're not able to breathe on your own. You need assistance. With that.
But for what they're doing right now, though, is anybody that's on a ventilator, from what I'm hearing.
But can they slow it down to get to that point? If you get in right away and get tested, and say someone is 75 years old, and they get tested and they have symptoms, they go to the hospital and they start treating them and they're isolated and quarantined, are there things that they can do to help their immune system to fight this off? And
Sure.
Yeah, you're going to make sure they have oxygen. Oxygen's the main thing. I've talked to a couple doctors in the hospitals, and they are using some medications right now, like hydroxychloroquine, chloroquine, Zithromax, on the really sick patients. Not if you're mild or you have you can still be at home. We're not treating anybody right now with that, but if you're in the ICU, that's what we're using it for. We've got a lot of calls about those medications when they came out and said, oh, this might work. We don't have the research yet, but they are using it in the hospitals, from what I've heard.
Yeah.
There's another one, remdesivir. It's a viral agent that was started for SARS,
And
MERS,
yes.
back in the early 2000s. That's got a bunch of clinical trials right now. So that might be the next antiviral next year to help. But it's still got to go through the trials, so it's going to be a couple months, probably about a year before that comes out.
I know a lot of doctors, and they're all in lockdown right now, and you guys are the heroes. You guys are working your butts off. I know around the clock, everybody's kind of trying to fight this faceless enemy. Are you taking new patients now? Are you guys locked down? Let's talk about your practice.
We're taking new patients.
Yep, we're seeing new patients.
We're in an interesting transition right now because we don't want too many people to keep coming to our office physically. So we're transitioning a lot of our visits to virtual visits.
Telemedicine.
Well, let's walk through that. Tell our viewers what a telemedicine. I'm at home and give me an exam. What are you gonna?
So Adam and I, when we heard
about
so when we heard about the virus coming out, and we're like, everybody's going to need to be isolated. This was probably about 2 weeks ago, before anything was started. We said we need to start offering e-visits, telemedicine visits to sick people, so we don't have them, spreading the virus, coming to the. We were thinking about patients as well as our staff, making sure our staff doesn't get sick, other patients in the waiting room. So last week, Monday, we started the process of switching all our sick visits to e-visits, so that we could do them through a virtual platform. So we have a video, we see each other, we're talking, we're communicating, we have all their history. They're not new patients, they're established patients, so we know a lot about them. So we started that last week.
But don't you have to see new patients face to face to make them a patient?
So new patients, we insurance.
Can you wave at them in the parking lot?
New patients, insurance requires us to see them in house, do an exam, make sure that we have all their information. Then we can do virtual visits for them.
Right.
And so we still have to do that. I don't know if they're going to change that. They may change it with this whole process going on, but right now we'd have to do that. So our current patients we've sent to e-visits, and then we got that working really well last week. We still did our regular visits. This week we're working on switching everybody to e-visits because I feel like it's going to be a few more weeks. So we want to be able to still take care of patients, but not put them at risk by having them go somewhere, and also not put the staff at risk by having them come in. So
give our viewers a flavor of your practice. You've got two parts to your practice. Explain those.
So there's our main practice, Premier Med, Family and Sports Medicine, and we do primary care predominantly, which focuses a lot on preventative medicine. And
I want to brag on that point because I've done a lot of things from you talk about crazy stuff. You guys are skiers and extreme sport. It's preventative. You guys really do talk to me regularly about what I eat and stretching. I've worked with your wife on that kind of thing. So I love your focus on preventative medicine. That probably keeps us out of the hospital.
I love preventative medicine. I mean, if you have somebody, the problem we had, patients would come in. I'm like, you have any medical problems? No. I'm like, what medications you're on? Metformin. I'm like, so you have diabetes? No. I'm on a medication for it. I'm like, no, you still have diabetes. you need to change your lifestyle, reduce your sugar, exercise, so that you can come off the medication, and then you wouldn't have diabetes. That's what we like to work on. I mean, most of our patients are they're active. They want to be healthy. So we focus a lot on okay, this is why you have the problem. Let's fix the reason for it so you can get off these medications.
And you guys went to school together, so I know you guys, you kind of developed the mission and culture of this practice a long time ago.
The other side of our practice is our concierge practice, and it's Prime is the name of it. And so that's available for patients who want more direct access to us. And it gives us more time to get to know them better.
So if you're on a ski mountain somewhere and you get hurt, and give us a call, we'll talk you through it.
So this was I remember when I first heard about this, it just seemed like old-fashioned, medical care. Back in the old days, you knew your doctor, and nowadays you get 7 seconds with your doctor on a family care purpose. And so is it a trend? Is it a fad? Is it going away? Is that growing?
It's getting bigger. It's getting bigger. Yeah. So you're going to see more and more practices going to this. A lot of them are moving actually to something called direct primary care, where they don't even take any insurance, and you just pay, you pay cash pretty much for what you're doing. But it's still a regular practice. It's not a concierge practice. So you're not gonna be able to call them on their cell phones and all that kind of stuff. You still call the office. Concierge medicine, if you got an issue, you can text us, call us, whatever you need. I
don't even know your office number. I just call you guys direct.
It's fine.
So I love that.
I mean, it's pretty easy, and we like doing it, so it's cool. We enjoy
Are
it.
you taking new concierge
Yes.
patients?
We are.
Okay.
We are currently. We're going to get to a point where we wouldn't be able to spend that time with somebody. We want to. We don't want a lot of concierge patients because we want to be able to know each of them, and so we would get to a point where each of us would have a certain amount, and then
You have a cap.
a cap,
We do.
yeah. And then
good.
if we needed more, we'd maybe try to find another provider to come on.
And you're located in Windermere. Tell me where your office is.
Yeah.
So it's right at the southern part of 𝐏𝐻𝐈, where 𝐏𝐻𝐈 and Windermere meet, and we've been there for really coming up on 8 years.
8 years, yeah. So we're in the building right behind Goodwill, right on McGuire and Robertson, right there. There's pediatric associates or physician associates.
It's a big office. I mean, you have a place to work out. I saw the space your
it's
wife
good.
has for stretching.
Yep, physical
and
therapy.
A lot of rooms.
Right.
And so, guys, give your contact information. Give me the ways you can contact you. Your
Sure.
office number.
Yeah, so phone number is 407-581-9065. We also have a website. Adam has a website.
PremierFSM.com.
And so, we're going to close out the show now because I'm going to have you back. You guys come back?
Sure.
Yeah, we didn't give any numbers. We didn't give any updates on the cases because this changes so rapidly, right?
Yeah,
We know this
yeah.
is bad. Top 3 things that people should do and look for, warnings you would give your family. Give our viewers one kind of summary of that again.
So fever, cough, shortness of breath, potential exposure, definitely contact somebody for that. That would be my major, that's what I'm recommending. And those, any type of potential exposure with those symptoms, they'll most likely get tested for coronavirus.
And if you don't need to leave the house, stay home. Keep your distance from other people. They say 6 feet or more.
6 feet or more.
Yep.
All right.
And make sure exercise while you're home. Don't eat all your supplies.
Right. And get plenty of sleep. That's one of the best things.
Yeah, we didn't talk about that.
Get
you
sleep.
know.
Sleep
That
is
is
really
the
good for the
number one
immune
thing for your
system.
You know, you guys have lectured me for so many years. I finally went off all caffeine.
Good job.
No alcohol, no
Proud of
sugar,
you.
and I'm sleeping so well. And that
amazing.
makes such a difference.
It's amazing. Good job.
I love you guys. Yeah, my wife loves you. Our kids love you. My parents love you. Dr. Gary Visser, Dr. Adam Langley with
Thanks,
Premier
guys.
Medical
it.
Group. I'm Mark Hayes. And stay tuned. We're going to be doing coronavirus updates almost every day.
Cool.
And because we're in real estate, but this matters, right?
Sure.
And so
Yeah.
we're trying to still do our job, but do it in a safe way.
Yes.
So thanks for watching,
Yep.
and we'll see you tomorrow.
Thank you for having us.
Thanks. Thank you.